How to eat right when undergoing IVF. IVF, or in vitro fertilization, is a complex process used to treat infertility and help increase the chances of having a child. IVF is currently the most effective form of assisted reproductive technology, but the chances of successful pregnancy depend on a number of factors, including the reason IVF is necessary, genetics, age, and overall health of the mother and father. We can't control every factor, but both men and women can take charge of their own health. The most straightforward way to take charge of your own health is through diet and nutrition. Method 1: Incorporating the right foods during IVF. 1. Increase all fruits and vegetables. When you are going through IVF, you should increase all your fruits and vegetables. These foods provide your body with essential nutrients, vitamins, and minerals needed to support a healthy pregnancy. Be aware that pesticide use may be associated with decreased fertility. There is a commonly held belief that organic produce is not treated with pesticides. This is not true. If you're looking for pesticide-free produce, find out the source and how they treat their crops. If you shop locally, you may be able to ask the farmer directly. Increasing fresh vegetables help increase your intake of iron, which is important for fertility. 2. Eat complex carbs. The majority, roughly 90%, of the total carbohydrates in your diet should be complex carbohydrates. This can help control any weight gain because complex carbohydrates take, in general, longer to digest and allow you to feel fuller longer. In addition, complex carbohydrates are recommended to lower the risk of gestational and type 2 diabetes. Avoid simple carbs. Simple carbohydrates are often found in processed foods. Eat complex carbs instead. Complex carbohydrates are found in whole, unprocessed foods such as whole grains, peas, lentils, beans, and vegetables. The reason that processed foods should be avoided is that they include both simple carbohydrates along with added sugars. 3. Increase the fiber in your diet. Fiber helps keep you full and aids in digestion. Beans, legumes, fruits with rind, and vegetables provide great sources of fiber. These foods also provide vitamins and minerals, including the important B vitamins, which boost your health and lay the groundwork for a healthy pregnancy. Eating beans also helps increase your iron intake. 4. Limit red meats. When you are pregnant, limit the consumption of red meat. You should aim for 3 servings or under each week. When you do eat red meat, make sure to antibiotic and hormone-free beef and buffalo. Consider buying lower-fat beef, such as 90-10 or 93-7. Lean meats may help boost fertility, while meats with high fat contents are believed to lower fertility. 5. Eat poultry. If you want to eat meat, increase the amounts of skinless poultry you eat. The poultry you buy should be hormone and antibiotic-free and free-range. Don't eat the skin on the poultry. The skin can be high in animal fat as well as any added hormones and antibiotics. If you are trying to get pregnant, you definitely do not want to add outside sources of hormones. 6. Add more wild-caught fish. Wild-caught fish is another great meat source. They are good sources of omega-3 fatty acids, which are essential for your health and are anti-inflammatory. They are also good sources of protein. Wild-caught fish also tends to be lower in contaminants, such as mercury. Look for wild-caught fish, such as salmon, cod, haddock, and tuna. 7. Incorporate more plant proteins. If you are trying to get pregnant, studies have shown that women who increase the amount of plant protein in their diet have fewer problems than women who eat more animal protein. Plant sources of protein include beans, legumes, nuts, soy, and seeds. 8. Drink organic, whole milk. When you are trying to get pregnant, choose full-fat dairy instead of low-fat or skim. A glass of whole milk can help boost your fertility. You can have 1 to 2 servings of full-fat dairy per day. You can also get full-fat dairy from other sources, like yogurt or ice cream. 9. Avoid sugars. Sugary foods and drinks should be limited in your diet. Added sugars can come in different forms. Glucose, sucrose, fructose, and high fructose corn syrup are often listed on food labels. Ingestion of large amounts of the aforementioned sugars is linked to diabetes in pregnancy, gestational diabetes, and adult-onset diabetes, type 2 diabetes, as well as other conditions like obesity and cardiovascular disease. 10. Avoid trans fats. Avoid trans fat when you are undergoing IVF. These fats have been shown to decrease fertility. Trans fats are not found in nature, but are man-made and found in processed foods, fast foods, frozen dinners, and meals. Method 2. Boosting male fertility through food. 1. Eat the same food as the mother. Men should eat basically the same foods women do when going through IVF. The foods described above provide an outline for promoting health and wellness for anyone who wants to get pregnant. If men have a diet too high in bad fats and void of nutrients, they can suffer from decreased libido and lower sperm counts. Approximately 1/3 of the infertility cases are a result of the male. By eating a healthy diet, you help eliminate problems with fertility and support healthy fertility health. However, there are additional foods men can eat to help support healthy sperm production to increase fertility. 2. Incorporate more zinc. Zinc helps boost a man's fertility. It helps raise testosterone levels and sperm count. You can find zinc in red meat, shellfish, lamb, deer, and poultry. You can also find zinc in sesame seeds, raw pumpkin seeds, and green peas. Zinc can be damaged by cooking, so you should look for foods containing zinc that can be consumed raw, like seeds and peas. 3. Add foods with folates and magnesium. Folate helps lower the number of abnormal sperm and improve sperm counts. These nutrients are found in vegetables, especially leafy green vegetables. Folate is vitamin B9, which is important in DNA and red blood cell production. It can be found in green leafy foods like spinach and kale as well as avocado and beans. 4. Eat selenium. Selenium helps the motility of your sperm. It is found in tuna, vegetables, and grains. 5. Incorporate CoQ10. CoQ10 helps protect sperm and sperm motility. This is found in fish, nuts, broccoli, strawberries, oranges, eggs, and seeds, as well as red meats. 6. Increase vitamin C. Men also want to make sure they get enough vitamin C. This helps maintain healthy sperm and the quality of sperm. Vitamin C can be found in citrus fruits, papaya, broccoli, strawberries, Brussels sprouts, kale, and bell peppers. Method 3. Promoting healthy habits for IVF. 1. Eat natural foods. Try to keep your food as close to its natural form as possible. Try to limit any processed or prepared foods in your diet. Cook your meals and prepare your snacks from scratch as often as possible. Avoid buying processed foods such as packaged snacks or prepared meals. Also avoid eating candies, cookies, cakes, and other dessert snacks. Processed foods have many unhealthy elements, including trans fat and added sugars. 2. Drink plenty of water. Increase the amount of filtered or purified water you drink. Try to get about 6 to 8 ounce glasses of water a day. 3. Read labels. When you shop for groceries, you need to read the labels. Foods that claim to be good for you can hide harmful, processed, or unhealthy ingredients. For example, read the labels to determine the amount of sugars in a food. A good general rule to follow when you shop is to refrain from buying white foods, no white bread, white pasta, or white rice. However, companies are not required to list added sugars. Avoid this trap by avoiding processed foods. 4. Maintain a healthy weight for fertility. Women with too little body fat tend to have greater difficulty getting pregnant. You should keep your body mass index between 20 to 24. For example, for a woman that is 5 feet 4 inches, that is a weight between 116 to 140 pounds. 5. Perform meal prep. You may not always have time to prepare your meals from scratch each day. To aid with this, do meal prep each week. Cut vegetables and fruit for the week ahead of time. Preparing the basics, like rice, beans, and even meats, ahead of time. You can freeze those ingredients or refrigerate the ones that will last in the refrigerator. If you are pressed for time, try using a crock pot. You can leave a crock pot on all day and have the meal ready when you come home from work. Tips. While food can play a central role in increasing your chances of pregnancy, you should also remember to get enough rest, relaxation, and sleep. Keeping in good physical shape will also increase your chances of successful IVF treatments. Just walking every day can help keep you in shape and help maintain your weight in the fertility zone.